Are you a pre-medical student who's finding it challenging to locate opportunities to shadow? If so, you're not alone. I'm Dr. Rajani Katta, and I've been a professor of dermatology for over 20 years, and I've worked with a number of pre-medical students over that time. And what I've found is that some students have found it really easy to find opportunities to shadow. Their mom's a doctor, and she's arranged opportunities with her friends, and it's no problem. I've also worked with other students who've really found it very challenging, and I'm working with a student now who is in a large state school, and what she's told me is that there are a lot of students who are looking for opportunities to shadow in this small college town. There's not enough opportunities to go around for all of the students who are interested, and she's approached me for advice. So one of the things that I have really gone over with her is that you need to cast a wide net. And I've created a blog post, and if you go to our website, you can find it there. It's The Successful Match, where I talk about 7 strategies to locate opportunities to shadow. And so in this video, I want to review those 7 strategies and go a little bit deeper into a few of them. What I told my student is that almost everybody can locate these opportunities, but it definitely can be more challenging depending on where you're physically, in terms of your geography, where you're physically located. It can also be challenging depending on privacy laws. So with HIPAA being instituted nationwide, that definitely made it more challenging for students to find shadowing opportunities because all physicians have to be very cognizant of the patient privacy laws. It also depends on the kind of specialty. So some specialties may be far more hesitant to allow student observers, student shadowing, because of the nature of the kind of medical care that's provided. Whereas other physicians might be more open to that. And what I say is that some students will hit the jackpot on their first inquiry, but I've had other students who've had to make 20 inquiries before they're finally able to locate an opportunity to shadow. So there's definitely an element of strong persistence, definitely an element of initiative, and definitely that element of creativity in terms of thinking about where and who you can approach for these shadowing opportunities. So in this video, I'll go over 7 of my main strategies on how to locate shadowing opportunities. If you're looking for opportunities to shadow, one of the first strategies I recommend is to contact your own physician, whether that's your former pediatrician or your current family practice physician. I think that's a great place to start. And what you would simply say is that you are a student at this university and you're very interested in exploring the medical field further. Would it be possible for me to shadow you at some point? Now, sometimes that works. Oftentimes the physician may say that that's not something that's possible at their institution, and this follow-up is incredibly important. The follow-up question is, do you have any colleagues that you think might be open to having a student shadow them? If they say yes, then you approach that physician. What you would simply say is that you're a student at this university and Dr. Katta recommended that you approach them to see if it would be possible to shadow. One strategy that I almost always recommend to students who are looking for opportunities to shadow is to start by asking their family members and their friends. You might have one physician, you might have 2 physicians. If you start thinking about your mother, your father, your siblings, your friends, they all have their own personal physicians. They may also be friends or have acquaintances who are also physicians. And so then you have a much longer list of physicians that you can reach out to. And when you're reaching out to physicians, you would use the script where you explain who you are, that you're a student who's interested in the medical field, and would it be possible to shadow them to learn more about their particular field. If you're looking for opportunities to shadow and you haven't had any luck within your own network of family members and friends, then another great source is to reach out to upperclassmen at your university who are pre-med students. I would start by asking, were they able to shadow? Who did they shadow with? Do they have any suggestions on who you might be able to reach out to ask about opportunities to shadow? If you are not able to make progress that way, it's also very helpful to reach out to alumni of your university who are currently medical students. So they've been able to find direct exposure to medicine just by virtue of the fact that they are in medical school. You know that they were successful in finding some opportunities to have that direct exposure. So you could reach out to them and ask for suggestions on physicians. Another strategy that I recommend for students who are looking for shadowing opportunities is to speak with your pre-medical advisor. So a lot of students think that they have to go this alone and find their own opportunities, but you can speak to your pre-medical advisor, and they have definitely had students who've had success finding opportunities to shadow, typically within the local area. So start by asking, where have students been able to shadow? A lot of pre-medical advisors will also keep a list of physicians that are open to having students shadow. And so you can ask for more information if they have a list or if they know of students who've been successful. And then you can directly reach out to those physicians and explain that it was suggested by your pre-medical advisor that you reach out to them. Joining your college's pre-medical society can be a very helpful way to find opportunities to shadow. Some of these societies have been in existence for quite a long time, and what that means is that some of them have established programs where they will connect their students with physicians who are open to having students shadow them. So just by virtue of joining the society, you might have access to such a program that connects you to physicians. If there's not such an established program, you will often be able to network with either your fellow colleagues or with upperclassmen who can tell you what's worked for them. They might be able to point you in the direction of a physician. They might also be able to give you a personal referral. So, Dr. Smith, my friend Sarah suggested that I reach out to you. So your pre-medical society is another great resource. Another important strategy for students who are trying to locate opportunities to shadow is via their volunteer work. So whether you're volunteering at a hospital, at a medical nonprofit, or at a charitable clinic, you may have contact with physicians. You might actually be able to work directly with physicians. Now, more commonly what happens is that you don't have that direct contact with physicians, and instead you're working directly with other healthcare professionals, perhaps nurses or perhaps nurses' aides. So one strategy I recommend is to speak with the nurses. Let's say you're on a hospital floor, and ask, are there any physicians that you think might be open to having a student shadow them? And then the nurses are typically great resources. And if they do identify one or more physicians, you can ask the nurse to make that introduction, and they can often facilitate that opportunity for you. Another strategy, if you haven't had any luck through your personal connections or through your pre-medical advisor societies or through your volunteer work, is to reach out directly to physicians. And this is a little bit more complex. It definitely requires a lot more initiative, and this is a little bit of a multi-pronged approach, and you have to get used to rejection here when you're reaching out directly to physicians. But I recommend that you start by looking around in your local area and go ahead and make a list of physicians whose work you are interested in. So you can look for specialties, you can look for physicians who are doing interesting things in your community. Start by making that list and strategizing about which physicians you would be interested in learning more about, and then you're going to contact them directly, typically via email. Let's say you've located a physician whose work intrigues you. What do you say in your email when you're reaching out to that physician? I actually have a script in our blog post about locating shadowing opportunities, but there's a few important points. One is that this has to be an extremely professional email. This is your first impression that you're making, so you want to follow all of the norms of professional emails. And the second thing is you have to think about the content. So you need to introduce yourself, why you are interested in shadowing, typically because you're interested in pursuing medicine as a field. And then you want to explain what it is about them and their work that interests you. So I'd love to learn more about primary care in a rural area, and that's one of the reasons I'm reaching out to you. So professional and with the content that introduces you and why you're interested in them. If you're reaching out directly to physicians to try to locate shadowing opportunities, oftentimes that's done via email, but sometimes you may decide to either call the practice or visit the practice in person. Calling is certainly easier. You may or may not have any success. It just depends on who's answering the phone. Some of my students have had more success going in person, and as the pandemic, as things open up, you may have success with this. I will tell you a few things. Make sure you are dressed professionally. I also recommend that you bring a printed out copy of a professional letter introducing yourself and why you're interested in this practice. When you walk in, you can ask to speak to the office manager and explain who you are. You're not going to receive a decision right then and there, but you can leave your information with them. Some practices may be open to that. If you're trying to reach out directly to physicians to locate opportunities to shadow, how many doctors do you need to reach out to before you hear a yes? The reality is that it might be one or it might be 20. It's really hard to say. I have to really warn you though to expect to not hear back from many of the physicians that you're going to reach out to. They're busy people, perhaps they've received a lot of inquiries, and that's okay. This ultimately does come down a little bit to a numbers game. If you're sure that your email is professional and that it has the right content and that you are personalizing it to each of the physicians that you're reaching out to, then you are going to have to just expect that you'll have to send out a lot of emails perhaps before you receive a yes. It's okay, it's just part of the process. So that's an overview of strategies for how to locate shadowing opportunities. Again, if you visit us at our website, thesuccessfulmatch.com, we have a blog post about this topic. We have a lot of other resources at the website. And as I said before, some students have it so easy when it comes to finding shadowing opportunities because their mom's a doctor and she's been able to find them opportunities. But for most of the students with whom I work, it's definitely taken a lot of initiative. Whether that's speaking to people on their own or trying to connect with their Premedical society or their Premed advisor or going out on their own and actually physically visiting doctors' offices, almost every student with whom I've worked has been able to locate some fantastic shadowing opportunities. Although, as I said, it's taken effort, it's taken initiative, and it's taken persistence. So if you're having problems locating or having challenges locating those opportunities, take heart. There is success, even though it might be a little bit more challenging. I wish you all the best in your journey in medicine. Good luck.